Good evening. Thanks for always staying with Lagos Television. The program is Sound Health. I am Olatunji-Agunbiade. Our focus today on Sound Health is prostate cancer, one of the 6th leading cancer in men. Dr. Temitope Olatunji-Agunbiade, consultant radiation and clinical oncologist, is on standby to let us know more about prostate cancer. Please stay tuned. The conversation begins after this break.
The COVID-19 pandemic has increased how societies value health. We have never been so aware of government actions to protect our health and well-being. Yet, too often, people's insights and lived experiences remained unheard in government decision-making. Governments must make a targeted effort to change this. Amplifying people's voices in health policy making by using participatory spaces as part of decision-making processes is the way forward. If these spaces are well designed and used regularly, they have a transformative potential to become a potent tool for more responsive and implementable policies. There are many ways governments can engage with the population to capture their needs. Mechanisms such as open forums, citizen juries, consultative meetings, and district health committees with fixed seats for civic and community groups are all methods of engagement. But government resources and capacities are too often lacking to manage these spaces effectively. The WHO Handbook on Social Participation for UHC provides practical guidance for policymakers to engage with the population by creating, strengthening, and sustaining participatory spaces. Policymakers must learn how to design spaces to empower people to express themselves frankly.
Joining us via Zoom this evening is Dr. Temitope Olatunji-Agunbiade, consultant radiation and clinical oncologist with the Oncology Department, Lagos State University Teaching Hospital here in Ikeja, Lagos. Good evening. Thanks for joining us, Dr. Olatunji-Agunbiade.
Good evening, madam. Thank you for having me here. It's so a pleasure coming to your program.
Right.
Thank you.
Always good to have you here too. So what exactly is prostate cancer and how common is it among men?
Thank you for having me on your program once again. It's always a pleasure. So prostate cancer is a cancer that arises in the cells of the prostate, whereby the cells continue to grow abnormally, and the natural programmed cell death that is supposed to occur where those cells die do not die, so they continue to grow haphazardly, such that they grow and grow till they are out, or they grow out of the prostate and to the surrounding organs, and sometimes they can spread to distant organs. So prostate cancer is the second most commonly diagnosed cancer and the 6th leading cause of cancer death among men worldwide, with an estimated 1,414,000 new cases and 375,304 deaths in 2020, according to the Globacom report, the NC and the Globacom report. Okay, so basically that's it.
Is it an age-specific disease in men?
Yes. Prostate cancer used to be, should I say, is rare in age 40 and below, but we're beginning to see more cases of prostate cancers in patients that are 40 and below. At least I've managed a patient that was 38 years old with prostate cancer. I've managed 40 years, 44 years. Way back, we used to say is disease of the elderly. We see them in people of age 70. From 50 and above, 65 basically, but recently we've been seeing them in younger patients as well. But it's supposed to be a disease of the elderly but we're beginning to see in younger patients. I mean, the average is supposed to be about 60 to 65 years, or basically from age 50 years. But we're beginning to see them in younger patients. Thank you.
Right, Dr. Olatunji-Agunbiade, tell us now, what causes prostate cancer in men? Since it's just a disease related to men, what causes this condition in them?
So there's indeed one major cause, but however, there are associated risk factors. I mean, there are, should I say, established risk factors, which include advancing age. I mean, I used to tell people that the male gender, I mean, this is my own theory, the male gender is a major risk factor, just as I used to tell patients, the people that the female gender is a major risk factor in female, because they never can tell who will have. So also in male, the male gender is a major risk factor. And to stop it all, advancing age, it's a major problem, all right? So, I mean, the risk increases as the age increases. I mean, as you're getting old, as males are aging, their chances of having prostate cancer increases. I mean, advancing ages. But like I said earlier, we are beginning to see them in people of less than 40 years. Okay, so but the risk of having it is higher in from the age of 50 years. Okay, so another major factor is the black race. I mean, black people have a higher risk of having a prostate cancer than people of other races. Okay, and it's commoner in Black African American compared to the Asians and the Pacific Islanders, where their chance of having it is lower. I mean, imagine in the black, the highest rate, I mean, you have the higher rate, I mean, 183.4 for 41 per 100,000 people, in contrast to 112.7 for all races. I mean, this is based on the National Cancer Institute documentation. So, like I also another thing that applies to the black people is that it is more aggressive, and most often the cases tend to be more advanced when they present. So another factor is the race. I think I just explained the race now. I just explained the race. Then the family history. There is a twofold chance of having prostate cancer. I mean, the risk is higher in somebody who has just one family member. I mean, just double fold compared to somebody who has like two family members. Their risk is about 3 to 5 times higher. So another thing is this. I mean, we're talking about genetic mutation. We're talking about the mutation of we're talking about the BRCA genes. We're talking about the BRCA1, BRCA2 genes, which are genes that are mutated in breast cancer as well. All right. So we're beginning to see incidences of prostate cancers. I mean, like prostate cancers, breast cancers, and ovarian cancers. So when we hear family histories of those diseases, we tend to go back and trace their family line and encourage them to do the BRCA testing to see if they actually have it in their family. All right. So I've mentioned the advancing age and all that. Then another thing is this: the one that we can really do something about. We're talking about the modifiable ones. I mean, one of the major risk factors is consumption of red meat. All right, red meat, eggs, dairy meals. They increase the risk of having prostate cancer. Then, the other lifestyle factors include obesity. I mean, when people are obese, they're not doing exercises and all that. So it's a major contributing factor. So we encourage patients to keep fit. Then I talked somewhere where they talked about asbestos. That the patients, people that the first responders, when they had the 911 issues in America way back, that they had a higher chance of having, because of the asbestos exposure, that they had a higher chance of having prostate cancer. So also is the vitamin supplement. I mean, those patients that usually take calcium, that it really increases their risk to having prostate cancer. So basically, those are the major risk factors that are common to or should I say that are culpable.
All right, thanks for that detailed explanation. Are there early signs to look out for before it graduates to a stage?
In the early stages of the disease, there may not be any sign, except because they're slow growing. The patient may not present with any sign and symptoms, except they go for screening. I mean, if they are lucky, unfortunately, we don't have that screening culture. We don't have that screening culture in our community. So which is why we're encouraging people to go for screening, because the early detection saves life. It means that the disease is just confined to the prostate, and that's when you can have the highest chance of attaining cure. So, unfortunately, most people present now with advanced cases, locally advanced cases, or metastatic cases, whereby when they present with hematuria. Hematuria means there's blood in urine, or some they have erectile dysfunction, or some when they come, they say they notice blood in their semen. All right, or some they say they're having painful pain, painful maturation. Starting urine is difficult, is a little difficult for them, or even some of them, they tell you that when they pee, they have incomplete voiding. I mean, it's like they're not able to completely pee. They have to press and press. They're able to pass, or basically have a such that you know how it's supposed to go the projectile way. I mean, it's just not flowing well. It will come, it will drop and dribble and all that. Or even majority of them even present with unexplained weight loss. Or back pain, low back pain that has been there for years that they're not just paying attention to. I mean, the back pain has always been there. Okay, the doctor is just there, and they just feel it's arthritis or something like that. Or some of them even present with fracture, or when the disease has confined them to wheelchair. But we're like, but this has been ongoing for a while. But they said, okay, they felt it to pass. So basically, those are basically the advanced forms of presentations.
What about erectile dysfunction and?
Yes, I mentioned erectile dysfunction. That some of them present to erectile dysfunction. I mean, those are still. I mentioned it. Those are still part of the signs. But some patients, they may be lucky, and that erectile dysfunction might be what we take them to the hospital, and doctor will examine. We'll take a detailed history, we'll examine them, do a detailed examination, or tell them to go for ultrasound scan, and if it's to pick some form of enlargement from there, I mean, like the cascade of events. From there, we'll go down to saying they take biopsy to pathology, and it turns out that, wow, this is really malignant.
How early should one go for screening? Should we wait till we start seeing symptoms or signs? How early should one?
As a matter of fact, once you are 50, all right, they say, because according to the risk stratification, they say 50 and above for men with average risk that there's no family history of cancer. But for everybody, once you are 40, just start going for screening. But now that I said we are beginning to have it in younger patients, it may be beneficial, maybe from 35 or thereabout. For what is internationally acceptable, I mean, they say for people, I've just mentioned people with average risk. I mean, they should start from like 50 or thereabout. But for men with high risk, I mean, meaning that, I mean, those black men with first degree relatives, I mean, diagnosed before age 65 or thereabout, like start screening, like, I think basically just 40, age basically 40. For men with very high risk, I mean, specifically those with family histories, with the one that has the 3.5-fold increase with 2 or more family members, that they should start screening from 40. But now, I just encourage patients, once you are 40, start doing all those screenings, and let's see what's going on. All right?
Is prostate cancer treatable?
Yeah, it is treatable. treatable if caught early. It's treatable. I mean, like I mentioned earlier, if you catch the disease very early, you're able to achieve, you treat with curative intent, and you're lucky it's well treated.
Okay, how can you avoid prostate cancer, and your action there? Actually avoid prostate cancer?
Some factors are way beyond the that you all right. So, but there are certain factors that we can put in place. You cannot help being of the black race descendant. You cannot help being in a family that has a history. I mean, those ones are way beyond you. But what you can do to help yourself are these factors that we talked about, which include early screening, going for screening, going for routine screening, and catching them early. But the major ones that we know we can do for ourselves, I mean, you maintain a healthy lifestyle, exercises, healthy diet, I mean, colorful fruits and vegetables. I mean, do away or reduce your intake of dairy meals. Or if you, I mean, once you're even 40, I mean, what are you still taking red meat for? So it's not healthy. Cut off on red meat. I mean, those factors that can predispose to having prostate cancer. I mean, regular exercise, do your diet, maintain a good diet, maintain a good weight. Just keep yourself active and go for screenings even at all times. And if you have family history, you know that from age 40, start doing your screening. From age 40, keep a close eye on your parameters. Do your regular PSA, do your PSA. The normal PSA is 0 to 4 nanograms per mil. If the PSA is higher than that, if it's up to 10, there's usually a high chance. Although there are other factors that can make the PSA go higher. We can have it in benign conditions like BPH and all that, catheterization, even recent intercourse and all the activities around the prostate can can even increase the PSA. But then having that at the back of one's mind, once you go regularly for screening, they know what the PSA is. Do your scan, I mean your general body, body screening and all that. There are tumor markers. Another factor is this. I mean, we've noticed that in some cases the PSA may not really be high, like in some different histological types. I mean, in small cell cancers, the PSA may not even really be high, and you're wondering that, this cancer is not this thing, but it's actually there. So call to action, always make sure they go screening, I mean, do ultrasound scan, and if that's the least you can do, and if the doctor says that they notice anything, if you have all those signs and symptoms, quickly go and see your urologist and let them do the general workup for you, and let them do the basic things that needs to be done.
I'm sorry, I have to take you back now. In women, when we talk about breast cancer, women evacuate their breasts just to keep lower the risk of having breast cancer. Is this also possible in prostate cancer? Can you evacuate the prostate gland?
You can evacuate, but then there are certain risk factors. There are certain problems that can occur when you do that. I mean, to mention prostate removal, they are jumping around and saying, doctor, you may want to remove, but everybody is scared. Certain things, I mean, there are certain risk factors that are problems that can occur from surgery. They may have erectile dysfunction. Some may even say the penis may shrink, but then about a year after, I mean, it may attain its normal. It may attain its normal length and function. So, but most often people I mean, nobody is even an advocate for prophylactic evacuation of prostate.
Doctor,
except people want to take it to greater height, another level.
All right, Dr. Temitope Olatunji-Agunbiade, consultant radiation and clinical oncologist with the Lagos State Oncology Department. Thank you so much for your time and always obliging us.
Thank you, madam. It's always a pleasure coming on your program and sharing knowledge.
All right.
Thank you so much. Thank you for having me.
All right. You're welcome. I have with Dr. Olatunji-Agunbiade, Dr. Temitope Olatunji-Agunbiade on how Sound Health continues with from the world. Please stay tuned. This is where we say thank you on today's episode of Sound Health. Remember, good diet and healthy lifestyle as well as early screening will help you beat prostate cancer early enough. Go for screening today and you'll be glad you did. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social #SoundHealth. A sound health is a sound mind. Make healthy living your choice.